advance the field of stem cell research and regenerative medicine, public education is a necessity. Our education award goes to the Global Immunization Action Network team, GIANT. GIANT works to improve global public health outcomes by combating vaccine hesitancy through effective, sensitive, science-based communication and education. Throughout the COVID-19 pandemic, their extraordinary team has provided important, credible, and factual information for people and communities around the world to embrace immunization with trust and confidence. Without health literacy, public health will fail. GIANT presents a novel and timely topic to the World Stem Cell Summit: health literacy, stem cell science, vaccine development, and confidence in the age of the COVID pandemic and infodemic. Forged by one of our greatest advocates, Bill Remack, this organization spans the globe to educate communities on the importance of vaccines. And in this era of the COVID outbreak, I can think of no organization more worthwhile to achieve and have recognition at the World Stem Cell Summit. With opening comments about GIANT, I'm very honored to introduce the president of the University of San Francisco, Paul J. Fitzgerald.
Hello, my name is Paul Fitzgerald, and I am the president of the University of San Francisco. I am very pleased to add my words of congratulations and words of profound gratitude on the occasion of this honor being awarded to one of the most popular and effective preceptors for USF's School of Nursing and Health Professions, Mr. Bill Remack, president of the California Hepatitis C Task Force. Last year, the task force launched the Global Immunization Action Network, also known as GIANT, whose mission is to, quote, improve global public health outcomes by combating vaccine hesitancy through effective, sensitive, science-based communication and education, unquote. Bill and his team have been recognized by the Regenerative Medicine Foundation for this important and very timely work. Bill has been an exceptional preceptor in our Masters in Public Health and Doctor of Nursing Practice programs since 2015, mentoring USF grad students who have gone on to follow Bill's model of a scientist in service of humanity. When he told us about GIANT's launch, he wrote that, quote, this project would not have been possible without the help of USF interns and others who have put in countless hours and dedicated themselves to this effort, unquote. Bill himself has faced serious health challenges personally: cancer, diabetes, and a double liver transplant. These adversities awakened and strengthened in him a passion for public service, for inspiring leadership, and a deep mentoring that wonderfully aligns with the Jesuit model of cura personalis, care for the whole person. At Jesuit universities around the world and for 450 years, we teach a commitment among our students to understand that a human person is a body, mind, and spirit, a member of a community and of a culture, past, present, and future. Bill's teaching style wonderfully meshes with USF's Ignatian pedagogy. Ignatian, a reference to St. Ignatius of Loyola, the founder of the Jesuits. For these last 5 centuries, our schools have integrated the study of the sciences with that of mathematics, literature, history, art, and all the other disciplines by which we come not only to understand the world, but also to care deeply about it and to form the world in the best and healthiest possible direction. For the past 7 years, Bill has been inspiring USF students to learn the best science, the best public policy, and the best philosophical justifications for those policies, and Also to reflect on why these students should become exemplary healthcare professionals who care for persons, communities, and all of humanity with courage and conviction. Bill Remick, congratulations on this recognition of your many, many contributions, and thank you for the many more to come. God bless.
Ladies and gentlemen, honored guests, and esteemed scientists, fellow remarkable awardees, attendees of the 2021 World Stem Cell Summit around the world. Our desire to launch an initiative to respond to the needs of educating the world to regain the trust and confidence in the incredible benefits of science and wellness advantages of vaccines was gradually building in recent years, but our Global Immunization Action Network team took off like a rocket due to the urgency to control the pandemic over a year ago. We quickly learned that the imperative for success and creating that capacity had real meaning to our collective survival. All scientists share this dilemma too, and for that reason, we dedicate our education award to the heroes of the past, present, and future in science and medicine everywhere. Because without all of you running into the explosive fires of diseases in the world, many of us here watching this and our children and loved ones would not be here today. On behalf of our humble but astounding giant team, an incredibly dedicated and compassionate, prestigious group of men and women in over 35 countries, the brilliance of our amazing interns, our many partner organizations globally, I stand here knowing so much work is ahead of us to convey the principles of science in energizing the world to become literate. And as we grow in fostering understanding of our motivation to bring miracles to healthcare throughout society for so many conditions that cause great suffering, despite the enormous avalanche of so much wrong information we all face from non-credible sources. I would like to thank Bernie Siegel, Executive Director of the Regenerative Medicine Foundation and founder and chair of the World Stem Cell Summit, his prestigious board of directors for honoring our team with the award for education for 2021. Knowledge is power, and as we learn and apply this incredible developing science of infodemiology to address health literacy, the importance of education and the continuity of learning never stops, because this will indeed change the world for the better. Now, with great honor and appreciation, let me introduce our Director General, head of the Global Immunization Action Network team, a wonderful leader, humanitarian, and educator, Dr. Terry A. Lewis.
Thank you, Bill. Esteemed colleagues and hosts, our fellow award recipients and attendees of the 2021 World Stem Cell Summit. When circumstances call us to action, we must respond. I'm honored to accept this award on behalf of the Global Immunization Action Network team, or GIANT. In the social media environment that unites us, alternative facts and misinformation travel like a brush fire, consuming truth, creating fear, and misinformation that destroys trust in established healthcare practices at a time when collaboration, accuracy, and speed are of paramount importance to quell the spread of infectious disease of all types. Under the sponsorship of the California Hepatitis C Task Force, GIANT was formed to address one of the most pressing needs of this global pandemic, that of accurate information about the safety of vaccines and related innovations, made consistently available to affected populations around the world through frontline health workers such as yourselves. COVID-19 has consumed the world's attention. We're horrified by the impact of the virus on local communities and remote regions of the world. We marvel at the speedy development of new vaccine technologies. While COVID is our most recent concern, it is not our only concern. Opportunists have also seized this moment to promote a fear of science, health practices, and each other. The deployment of old and new vaccines within this pandemic climate has proven to be a challenging task for all of us, made more difficult by messages designed to create mistrust and fear of our fellow man, our various international health partners, political institutions, and more. The battle for our healthy planet requires that we deliver consistently accurate information as trustworthy messengers in order to instill confidence in the tools of health literacy. Giant has responded to these challenges by reaching across political and cultural boundaries to existing health networks. We have assembled a team of local health leadership across government, private industry, NGOs, and local community systems to build tools for accurate messaging delivered through culturally fair strategies and trusted messengers. We're a very young organization, but our goals are very big. We continue to seek partnerships from all corners of the world, putting aside our differences to support each other, irrespective of political differences. With our partners in Europe, the Middle East, the African continent, North and South America, and Asia, we are examining our shared obstacles, developing collaborative learning tools to combat the infodemic of inaccurate health information that spreads distrust in health systems, health workers, and health practices. We gratefully accept this Action Award for Education from the Regenerative Medicine Foundation, and we invite you to follow our progress. Thank you.